I'm Robert Bauman, inviting you to go to health. Yes, I said health. Today I want to introduce you to an intriguing, low-invasive medical treatment. It's called upper cervical chiropractic, or NUCCA. NUCCA stands for National Upper Cervical Chiropractic Association. The unique thing about this treatment is that it focuses only on the very top part of the spine, the atlas or the C1 vertebrae. We're in the office of Dr. Brent Noorda. And Dr. Noorda, I understand the NUCCA treatment addresses a wide range of ailments, everything from back pain, headaches, you said knee pain, fibromyalgia, even multiple sclerosis. I mean, how can working on such a small area of the spine relieve so many problems all over the body?
Well, you see, Bob, I'm glad you asked that question. It all has to do with the anatomical importance of where atlas is in the body. When atlas misaligns, it knocks the head off balance a little bit. This, in turn, makes the body twist and lock down in a compensated position to put the head back on straight. Muscles tighten up in different parts of your body, lifting up on one pelvis. As we walk around in this compensated position, we start getting knee problems, arthritis, herniated discs, chronically tight muscles. And it also has to do with the way the nervous system travels and funnels through atlas. A misalignment there will cause fibromyalgia, neuropathies such as numbness and tingling, and all sorts of different issues throughout the body.
In order to determine if a patient is carrying more weight on one side of the body than the other, Dr. Noorda weighs him on double scales. If a misalignment is suspected, Dr. Noorda takes precise x-rays of the head and neck. He then measures the angles of the head and neck by tracing lines on the x-ray to determine certain critical angles.
As you can see here, your neck is deviated off to the right-hand side, your upper cervical spine, this area right here, off to the right-hand side. We see the atlas, the top bone in the spine, is slightly lifted up on that side as well, and your head is tilted on atlas off to the right-hand side. So what I'm going to do is have you lie down on your left-hand side, and I'll contact your right-hand side. My whole goal is to get you to stand up straight. As I do that, it'll take the structural strain off your body, off those discs, off the arthritis, and off the muscles that are holding your neck up, causing the nerve problems in your hand. In turn, that will also take the neurological strain off your body so that your nervous system can then function the way it should. And we should start getting some healing back in this hand pretty soon, some feeling back in this hand pretty soon.
Oh man, that would be great. Okay, well, should we do it?
Let's go for it.
Okay. Here, Dr. Noorda is making tiny corrections that realign the way the skull sits on the spine. He uses only about 1 ounce of pressure. I felt hardly anything. Dr. Noorda then checks the patient's weight balance and alignment again. The patient is invited to relax for a few minutes and let the correction settle in.
Bob, I'm really excited with the way today's visit went. The post x-rays show that we've got a good correction. Your neck was leaning way off to the right. Even though we got such a good correction, it will take the next 2 to 3 months to really stabilize your neck, and especially the next 2 to 3 weeks will be the most critical and the most important with that.
If you want to see how Dr. Noorda can help you, simply call 435-688-2292 or go on the web to www.balancespinalcare.com. Thank you for watching this segment of Go to Health. I'm Robert Bauman.